Well, St. Louis County has been at the center of the debate over whether COVID restrictions went too far. The Power of Two's Blair Lede joins us live from Clayton with a newly approved bill aiming to add some more checks and balances into the system. Good morning, Blair.
Good morning to you, John. Well, as you all can recall, when the pandemic first began in St. Louis County, there were a lot of issues with business owners, restaurant owners saying that the restrictions in place were just too tough. Others saying that they felt that decision didn't need to be up to just one person. So this bill headed to the governor's desk could be the bill to change the way that things go during a state of emergency. Now, this would allow a local county council to end a public health order after 30 days. Plenty of protest here in St. Louis County over those restrictions involving youth sports, indoor dining. Here's how the legislation now headed to the governor's desk would work. Supporters say if the state has a state of emergency in place, a simple majority from a council can continue those restrictions. Without a state of emergency in place, it would take a 2/3 vote from a council to keep a restriction from ending. Here's what some had to say about the bill headed to the governor's desk right now.
Every branch of government in our constitutional system needs to be accountable to the people, and the people, of course, through their elected representatives.
But I feel like it comes down to the health department should know best, basically because they go over that kind of stuff in general, and the city doesn't necessarily know as much as they do.
Now, a statement from the county executive's office reads in part, public health decisions are best made by public health experts in the Department of Public Health. Well, if the governor does decide to sign this legislation, the county council could be determining if the restrictions in place right now in St. Louis County would continue or not. Reporting live from Clayton, I'm Blair Lede. Back to you.